All right, welcome back. A new Super Bowl champion will be crowned this Sunday. That's no secret. You can watch it on our partner station, Fox 29. But guess what? You can be a champion for your own health. We've got Dr. Andrew Savin here with us to talk about how you can live that healthier lifestyle. And this one's going to be simple to remember because you say it comes down to one word. Let's run through it. That word, you guessed it, is health.
Health, absolutely. I tried making it 5 letters, but H-E-L-T-H didn't really sound very good. So I went H-E-A-L-T-H.
Okay.
So this is basically, after 30 years of seeing people, what really I boil down to the most important things that can really help people's health. I've talked about sleep here. I've talked about aortic aneurysm screening, some other things. But really, a lot of it comes down to some basics. And what I've decided was the first H being high blood pressure. There's about 1 out of 3 adults that have high blood pressure in the United States, and only about half of them are even controlled. So there's a lot of pre-hypertension too, people that don't have high blood pressure yet, but they're pretty close. And it's very important that people get their blood pressure checked more than anything else. It leads to almost 400,000 deaths every year, one way or another, between what it does to your heart or your stroke and that. The E was actually eating well. A lot of people just don't eat healthy. They're not eating quality foods. They're eating more processed foods. They go out, they eat fast food, they drink sugary drinks. They're not eating fruits and vegetables. And I've certainly found that most of the people that I see who eat these really good whole grains, lots of good fruits and vegetables, even organic fruits and vegetables, seem to be much healthier. So I always tell people to do that and not be drinking sugary drinks and too much juice. The A is activity. Activity. We got to get at least 20 or 30 minutes of some moderate activity. It doesn't have to be running on a treadmill at 10 miles an hour for an hour every day. It could just be something as simple as a walk, a bike ride, going swimming, going through the mall, anything physically active 5 days a week. That was another important one. The L is actually labs. So I talk about people to get some blood work. It's important when you're not feeling well to get blood, but the most important 2 things that you get is your blood sugar and your cholesterol. In the United States, we are dealing with about 100 million people with diabetes. I mean, it's really, really going on very much all over the country and all over the world. And I see a lot of pre-diabetes as well, so I'm really telling people you've got to get your sugar screened. Cholesterol management is getting much more specific now. We have very specific rules of who needs cholesterol medications, and most people do fine when we treat them. The T is what I call troubled hobbies. I mean, troubled habits.
Troubled habits.
Right, troubled habits. And of course, that would be something like tobacco or alcohol, drug use. Really quitting smoking is very important. The alcohol, we used to say 1 a day for women, maybe 2 for men. It's really starting to come down, and now I'm telling people maybe a couple a week. And then last but not least is happiness. Health and happiness are very closely associated with each other. I really try to make sure that people who are unhappy, they have stress, we all have stress, of course, trouble at work, trouble at home, maybe health, family issues, to get some help, see their doctor, talk to them about that. I think it's important for a lot of people to have a hobby, maybe something that they enjoy doing, to make sure that they're resting enough and that they have some time for themselves. You know, we all have the computers and the jobs, and it's very busy, but you've got to find some time to, take a walk, relax, do a, a crossword puzzle, something like that, right? That seems to be very helpful. And when I look at people who have all of these 6 things that they do, they tend to stay a lot better.
And annual appointments, so important for even if you think nothing's going on, to get checked up.
I think it's good to see your physician because, again, you want to be screened for your cancers and you want to be screened for these diseases and make sure you're up to date on your vaccinations. But even more importantly, when you see your physician, to just tell them, if something is going on, they're not feeling well, and they could usually help you or send you to somebody who can help you as well.
Dr. Savin, thank you so much.
Thank you.
We appreciate your time.